Thanks so much, Rachel, and thank you for leading us in this new faculty orientation. So, as Rachel just said, I'm Maria Oliva-Hemker, or people know me as Maria Oliva. So that's how I know if you really know me, is if you just say Maria Oliva, because I've been here for such a long time. And it is my pleasure to welcome all of you today. I know that some of you have already been here at Hopkins a little bit longer than others, but hopefully you will be acquiring some new knowledge that you're going to find helpful for you. So as Rachel said, I'm Vice Dean for Faculty, and I've been in this position now for about several years. I came on in 2021. And it's been quite a wild ride and experience, but all positive. I'm also Division Director for Pediatric Gastroenterology, Hepatology, and Nutrition. And one of the things that you will see about those of us that are in leadership positions here at the School of Medicine is that most of us are not full-time administrators. So 50% of my time on paper is spent as Vice Dean for Faculty. The other 50% is spent being a faculty member, a division director, pediatric gastroenterologist. So I have, ambulatory clinics, I'm covering inpatient service, I'm doing my endoscopies, and that's a good thing, right? Because it means that I and many of our colleagues were there doing the types of things that you folks as faculty are doing and walking the halls, and that's really important. You've already heard people say, feel free to contact us directly. Here's my email, moliva@jhmi.edu. If you have any kind of more general questions, there's also this generic vdfaculty@jhmi.edu. So please feel free to just reach out to us if you have any questions, concerns, kudos that you want to give. We're happy to hear from all of you. So I'm going to use my talk to focus on some of the activities of the Office of Faculty to give you kind of a bigger picture of where we fit in here in the School of Medicine, and also, a few little kind of resources here and there. I'm going to talk a little bit about procedures and policies, but please do not fall asleep during that time. It's going to be important for you to hear my few slides on that. And I'm going to introduce some of the resources that you're going to be hearing a little bit more about the rest of this morning, okay? So let's start just with where do we fit in the School of Medicine. So the School of Medicine is one of 11 schools and divisions of Johns Hopkins University. The president is Ron Daniels. Now, the School of Medicine has just over 50% of the faculty compared to all of the other schools. All right, so clearly we by far are the biggest school. There's 11. The most recent school is the School of Government and Policy. They're primarily housed in Washington, D.C., in a building on Pennsylvania Avenue where you can see the Capitol when you walk out the front door. And these schools are spread out, not just here in Baltimore City, but also in Baltimore County and Howard County. So this is what makes up Johns Hopkins University. You are part of Johns Hopkins University. If you're a faculty member, your compensation, your salary, you'll see most of your checks say Johns Hopkins University. So it's important for us to understand where we fit into the greater picture. Bloomberg School of Public Health and the School of Nursing are right across the street from us. So they are colleagues that we very often, interact with from research and education, but we certainly interact with colleagues in all of these other divisions as well. All right, it's important for you all to see this at least once in your faculty life, which is the Johns Hopkins Medicine mission, right? What is our mission? To improve the health of the community and the world by setting the standard of excellence in medical education, research, and clinical care. Diverse and inclusive. Hopkins Medicine educates medical students, scientists, healthcare professionals, and the public. Conducts biomedical research, and provides patient-centered medicine to prevent, diagnose, and treat human illness. And now this is the old logo. This is when I was a medical student here, and yes, I've been here since medical school, okay? When I was a medical student here, this was the logo, and I'm putting it on here because it has research, education, and patient care. So when you hear people talk about the tripartite mission of Johns Hopkins, this is what it is, all right? The stylized version up there in the right upper quadrant there of the, I'm talking like a gastroenterologist, the right upper quadrant of the abdomen up there is the more stylized version. And so the words were removed, but it's important for you all to know that this is what was in the original logo. This is our tripartite mission. So here's just a very quick snapshot. What is the group of people that you all are joining? What does the School of Medicine faculty look like? Well, we have more than 5,000 total faculty. We have 3,401 full-time faculty, and we have more than 1,800 part-time faculty. About 90% of our faculty are in the clinical departments. You'll see the next slide will show you the departments, and you can find yourselves there. And then breaking out by faculty rank, most of our faculty fall within these categories here. As you see, the majority are at the assistant professor level. We have about 10% research associates, 4% instructors, and the professors and the associate professors are pretty equivalent in terms of numbers there. So here are the 30 departments in the School of Medicine, and hopefully all of you, is there anybody who does not see their department up here? Hopefully that is not the case. The departments here in black are the ones that we call the clinical departments, and then the departments in blue are our basic science departments. And as I said, about 90% of the faculty are within the clinical sciences. Our basic science faculty are primarily PhD faculty, but we have many, many, many PhD faculty that are embedded in those clinical departments. All right, here's an overview of the leadership of the School of Medicine, and you've already met a number of individuals today. You already had the welcome from Dean DeWeese, the CEO of Johns Hopkins Medicine. And then you have the vice deans. You met Landon Keene, our executive vice dean, Anthony Rosen, vice dean for research, and Peter Espenshade, who's the interim vice dean for education. I want to also point out Gail Dommett, who's the vice dean for clinical investigation, Rick Redette, who's the vice dean for clinical affairs, and he's the head of the clinical practice. So if you're involved in clinical work, you will be hearing about the clinical practice. Kathy Wood just joined us this year. She's the Vice Dean for Finance and Administration. James Berger up there is the Vice Dean for Basic Research. And then George Jallo lives in Florida. He's the Vice Dean for All Children's Hospital. So this is the group of Vice Deans. All of us are very accessible. Dean DeWeese is very accessible as well. So now let me hone in a little bit on the Office of Faculty. We are here to serve all of you, right? You folks are our constituency. And these are, wow, those colors look like they aren't even showing up there. So they're really nice little circles around all of those lines. But these are kind of the umbrella areas in which our Office of Faculty works. Professionalism, appointment and promotions, career leadership development, faculty data, faculty information systems, transitions like coming in as new faculty, becoming senior faculty, retiring, transitioning to other parts of our community like the academy, all policies and procedures that have to do with faculty. The governance, the faculty senate, and advisory bodies, those are all our interactions with faculty and that you can be participating in. And then we have a close relationship with the Hopkins Medicine Office of Well-Being. And so here are the faces of the deans in our Office of Faculty, and you've already met Rachel. You're going to be meeting the other deans, many of them, along the way. A couple of things that I want to highlight for you. Similar to what I said about myself, the vast majority of these deans also have a life within the their faculty components, so that they are not spending most of them, 100% of their time, in the Office of Faculty. They're also faculty members within the School of Medicine as well. And this is just an amazing group of individuals who are very, very strong advocates of our faculty. You're going to get to know them, and you can reach out to them as well. And our office obviously would not be functioning if it were not for our great staff. Rachel already gave a shout out to Charmaine and Tisha and Tracy Norman, and eventually I'll get photos from Tracy Kelvin and Casey, who came on board. But these are all individuals who are working full-time in the Office of Faculty and really are the ones that are amazing at helping us get the work done. All right, now policies and procedures. A few slides here, but this is really, really, really important for you to know. You will hear people talk about the Gold Book, the Gold Book, the Gold Book. That is the framework for interaction between faculty and School of Medicine leadership and the School of Medicine. And in this Gold Book, which you can find on the web, it contains all the policies for appointments, reappointments, contracts, leave, as well as global criteria for promotion. And you as a faculty member, I know that I see many of you just pulled those out. Keep those, because there may not ever be another copy like that in the near future, because the next one's going digital. So these will be vintage Gold Books that you're going to have in your hand. But this is really important for you to have. Any issues about these things, we always turn to the Gold Book and we say, what does the Gold Book say? All right? Really important for us to have. There's some schools actually that don't have documents like this, and it's important because it helps ground us. This is the Silver Book. This is the Professional Development Guide. This is really important and was just updated in 2025. And the Silver Book is like the cookbook. If you want to know how to get promoted at Hopkins, this is what gives you very, very detailed and helpful information about promotions, about faculty development. It gives examples of everything from how your CV should look to when it comes time to promotion, what are those letters going to say? And the Silver Book, although you can, for those of you that like paper, you can download it as a PDF. It's actually now a digital electronic format because we felt that people would find the areas that they want to look at a lot easier. So you can look at it on your cell, you can look at it on your laptop. So this is a really important document for you to know about as you're heading to not just the time you're actually thinking, oh, I'm going to be promoted next year. This is what you should be looking at now in order to see what's the important pathway for you. And then for faculty that are part-time, we have the Blue Book. And again, it's similar to the Gold Book, but it's specifically for our part-time faculty. All right, pathways to promotion. I have just one slide here because you're going to hear a lot more about this later on from Nadir Faraday, but I just want to highlight this for you because this is important about being here at Hopkins. For like 100 and blah, blah number of years, Hopkins only had one track, and everybody was promoted on that track. It was the scholarship track. And as of 2020, because we realized that it was so important to value the hundreds and hundreds and hundreds and hundreds of faculty that do primarily clinical work, the Clinical Excellence track was born. So for the scholarship track, it focuses on dissemination of new knowledge, national and international recognition. On the Clinical Excellence track, it's sustained clinical excellence. You need to be involved in the tripartite mission. At Hopkins, it's not enough to just focus on one thing, but it's involvement in discovery and education, and in this case, having regional and national recognition. Now, this is very important here in that purple box about Johns Hopkins, because that's different, I can assure you, from any other institution that you were connected to. And that's that both of these tracks are considered tenure tracks. That means that if you are a full professor, then you have what is known as tenure, or a contract to retirement. In the vast majority of our other institutions, tenure is not granted on clinical tracks. It's only reserved for people that are on the scholarship track, which is typically the minority of faculty in that institution. So that just shows you how much we value clinical excellence here at Hopkins, as well as scholarship. And maybe soon, we will also be having an educator track. Right now, there are colleagues, and actually Rachel Levine is leading that task force to see if we are going to be able to accomplish this for our educators. Right now, most of our educators either get promoted along the scholarship track, or you can be an educator and also be promoted along the clinical excellence track. All right, these are professional expectations of faculty, and these are key policies for you to know. And why is this important? It's important for us to have a culture of respect, a culture of collegiality. You heard this panel of leaders talk about how important it was for the people here at Hopkins to keep you here. And that's why I'm here as well. When everybody says, why did you stay, why did you stay? It's the people, the people, the people, the people. And you want to be surrounded by people that are respectful and that are collegial. So these are policies that are really important for you to know because they guide much of what we do here. There's the School of Medicine Professional Code of Conduct. Very important. You can Google it. It's on the bottom here on policies. It can be found there. There is a policy on conduct for teacher and learner relationships. We expect our faculty to be respectful in educating our learners to be role models. You heard Peter Espenshade talk about the importance of education here at Hopkins, and it's important for us to have an atmosphere of mutual respect, fairness, and trust. And there's a personal relationship policy. We know that there are a number of you that may become connected to individuals here at Hopkins or that are already connected. It's important to disclose if that ever happens. So if you develop a relationship with somebody within your division, within your department, somebody from the hospital who is overseen by your department, please disclose it. That's the important thing to do. And then we can establish factors to ensure that the more senior person doesn't have any particular oversight over the person who may have maybe a lower rank. So there are many policies here, but if you have to think about the top three, these are the ones I want to show you. We are, like Dean DeWee said, it's more than 40,000 people. We're more than 3,600 or full-time faculty. This is a village. This is a community. And whenever there's a village, sometimes, there's sometimes things that don't go as well as you'd like, and you need to figure out how can I reach out, and can I do it in an anonymous way. And so this is what I want you to be aware of, is that at JHU, there is a hotline for complaints and concerns. It's called Speak to Us. There's the phone number right there. There's a website. You can fill out a form. You can put your name on it, or you don't have to put your name on it. But it's important for you to be aware that there is such a thing that exists here at Hopkins University, and we use it at the School of Medicine, as all schools do. All right, let's shift here a little bit. Here's one slide about your life as a faculty member in 3 phases. And this was put together, these recommendations were put together by our Faculty Affairs and Development Board, one of our advisory groups to the Office of Faculty. What should we be thinking about kind of globally as you kind of enter and go through this first year of being a faculty member? Well, phase 1 is make connections. We've been asking you to make connections today with folks that you may not know, make connections obviously with your division, with folks in your department, meet colleagues, meet leaders, identify somebody that's going to be your friend, your buddy, that you can kind of go through these first years together, and make sure that you attend all of the events, all of the faculty meetings for your department and your division. Phase 2, you want to start aligning your professional goals and expectations. So what is your role? What is it that you're expected to do in your local arena? Understand your compensation. What makes up your compensation and where is it coming from? What are you being compensated to do? You need to know this. I'm hoping that the administrators and the leaders in your department are clearly telling you this. If you don't know, then you want to ask your kind of the next person who's your superior. And if you don't get information that makes sense to you, then just keep asking. This is our responsibility to tell you, but it's also your responsibility to understand that. And you want to continue your dialogue with your division and your department leaders during this time. And then in phase 3, you're going to be starting to establish a professional development plan. And this is kind of a 2 to 3 year plan. It's hard to plan much further than that. You're going to try to find good mentors. I think the days of just there being one mentor are long gone. It's a community of mentors, a village of mentors that you need to help you along. Learn how to secure resources. You're going to hear a boatload of resources today. It's going to seem a little bit of a blur, but we want to make sure that you're aware of those. And you want to understand academic promotions, not 3 years from now, but right now. All right, and I'm going to end up here with a few other tidbits about our Office of Faculty and how you can get information. There is a monthly newsletter called Faculty in Focus. Here's 3 samples of that newsletter. They'll come up. They will highlight and give kudos to people who have been promoted and also provide other information about the Office of Faculty or different types of program. Please be aware of those. Click on it and open it. There are going to be monthly emails that have some additional information about career development programs and resources. These contain a link to a faculty development video library where you can look at videos, webinars that have taken place in the recent past and that still have information that's important. We have an Office of Faculty YouTube channel, and that channel is actually going to have today's new faculty orientation on there. And then I'm going to end here with the Office of Faculty homepage, and that QR code will take you directly to the Office of Faculty homepage. This we've designed to be kind of an entry portal for you to find information that you may need at different stages of being a faculty member. Again, everything from promotions to faculty development to issues about faculty compensation and faculty governance. So please be aware of this Office of Faculty homepage. So I just want to, again, thank all of you for coming and taking some time. I know it's not easy to take this few hours out of your day, but welcome. And again, please know that you can reach out to us at any time. So thank you so much for your attention.